I actually started off in special education and at the Ohio State University, and part of my program you had to select a minor. And my minor that I selected was communication disorders, and with that is speech language pathology and audiology, and I took my first introduction to audiology course and fell in love with it. And then it was in my master's program that I really started to develop a love of the balance system, and just was amazed at how much the balance system interconnects with so many sensory systems, and how one little part of our balance system, if it's out of whack, it can put a person with symptoms and at risk of falling. And it just really made me think about that from a clinical standpoint as well as research, what I could do to help these patients. I get to spend about 2 hours with my patients, which is wonderful. So I often don't have follow-up with my patients, but we have a good chance to really sit down and delve into what's causing their symptoms. So if they felt at other appointments, maybe things were rushed, they have more time with me where we actually spend a good 20 minutes, sometimes a half an hour, just discussing their past symptoms, currently what's causing problems for them. We also go into quality of life. How is their symptoms impacting day-to-day activities? What restrictions do they have with their symptoms? There are treatment measures that I am able to perform for patients, but typically I'll help diagnose, help with their management plan, and then move them on to the correct physician or specialist to help them with their treatment. Falls are actually reported as the second leading cause of injuries for older adults. And dizziness is one of the most common reasons for them presenting to the emergency room. So those two things hand in hand are reasons why patients may want to come for a full evaluation.